we want to do the introductions, everybody? So my name is Shirley Saida, Councillor for St Helly Award and Chair for this committee.
Thank you, Chair. I'm Octavia Lamb, Head of Policy, Strategy and Partnerships at the Council, helping Councillor Saida.
I am Councillor Beverly.
Hi, I'm Dean Tyler. I'm Assistant Director Policy and Strategy at Merton Council.
Right, I'm going to go online now. Zoe.
So evening all, Zoe Gallen. I am the Violence Against Women and Girls lead.
Hannah.
Hello, I'm Hannah Neal, BANE Voice.
Desta.
Hi everyone, my name is Desta and I'm a project manager with the Croydon BME Forum. It's a pleasure to be here. Thank you for having me.
Thank you for joining us. Unica.
Hi, I'm Unika and I'm also a Programme Manager at Croydon BME Forum, working on the Can You See Me programme.
Thank you. Amy.
Amy Dimitrescu, Head of Democracy Services.
Right, thank you everybody. Two apologies, one from Councillor Emma Stringer. Any other?
No.
That's it. Right, so moving on to the agenda.
And Andrew Brown's just joined.
Yes, from BME Forum.
Hi, good evening, everyone. Hi, I'm Andrew Brown, Chief Executive of Croydon BME Forum. Nice seeing you all.
Thank you, welcome. Right, so minutes of previous meeting, any amendment or any changes needed?
Oh, apologies, Councillor, I'll amend that.
Right, so that's noted, Councillor, as the digital apologies, it wasn't noted, not updated. Right, all agree?
Yeah.
Right, so that's ready, that's okay to carry on. And we now have a presentation from Zoe about violence against women and girls strategy. I'll hand over to you, Zoe. Thank you.
Thank you all. I've got some slides to share because I like to do visuals in my presentation. I won't go through all the slides because I'm conscious of the time. And in my slides, I've got some videos, which I won't do tonight, but I will share the slides so people can watch those videos once they get the slides. So let me double check that you can all see that, if the tech lets me. Yay. So our new Ending Violence Against Women and Girls strategy was launched on the 24th of February. We had an event locally on Borough, but I'll just go through some of the achievements that we've achieved over the last strategy and how we're going to take them into the new strategy. I'll also go through what our priorities are so that everyone can kind of see what they are, and then kind of let you know the next steps, because it's great to have a lovely, shiny new strategy, but actually how are we going to implement what we want to achieve? So just what we've achieved so far. So over the last couple of years, we've been working with an organisation called VoiceBox. They have been going in and out of our primary and secondary schools, talking to boys and girls about healthy relationships, but also working quite closely with our boys around what is it to be a boy in today's society? What does that look like? How can they kind of have a free, safe space to kind of open up around what do those expectations look like? Expectations from girls, expectations from society. And they've done some brilliant work. They've worked probably something like 20 odd schools. We've got an event next week for them to kind of showcase their work. And once I've done my slides, I'll pop the link in the chat. So anyone is welcome to come along. It's at Vestry Hall in Mitcham, and you can kind of come and see some of the work they're doing. And we're hoping to have some of our young leaders, the students from some of our schools, talking about their experience. But one of the things VoiceBox helped us do last year was a male panel discussion at AFC Wimbledon Football Club. And as you'll see in the middle photo, we had some brilliant guys talk to us about their experiences growing up as a boy into a man, and what does that mean. It was, yeah, brilliant, and we definitely want to do that again as part of the new strategy. We had a really rare, awful sexual assault a couple of years ago, and it was really super rare for us to have that kind of on the highways, on the public street. And it was a lady that was out running before she went to work, and we knew that something had to change. So what we did was we teamed up with the Mertons Borough Sport team, and we've got some violence reduction unit money, and we set up some running groups for women only. It's led by women for women. All our run leaders are volunteers, but they all get qualifications from the London Athletics, so they are fully trained run leaders. So we worked kind of collectively. We've now got 3 groups running. And we've had some brilliant feedback from our ladies. Some of those ladies had never run before. They've now been doing park run, 5K runs, all sorts of things. And we've teamed up with Hercules Wimbledon Athletics Club, and they have allowed the women to use that as their base for doing training days and other things. So that's just going from strength to strength, a small idea that's really blossomed. Our white ribbon, we are white ribbon accredited, and under our white ribbon accreditation, we have male ambassadors and female champions. And our male ambassadors look at how can they kind of support other men to end violence against women and girls. But it's also that male peer-on-peer support for our ambassadors. We know that men are at a higher risk of suicide and other health issues. So actually our ambassadors are a bit of how do we keep men healthy, but actually how can those men also then kind of spread the word and look after other men. We've had lots of events. We've done lots with our football club, and we've had a walk in November. We had over 50 participants and 3 dogs, most importantly. And it was just a morning of us walking around Mordenhall Park, chatting with others are passionate about this work. And we will continue to do those walks because that's how we can also talk with residents around some of their fears and concerns. And the majority of the people on that walk were residents. Safe havens is fairly new for us. We've got 11 venues on Borough now signed up, and a safe haven provides that kind of place of temporary safety for anyone that needs it. It was originally kind of set up around women's safety, but actually all 11 venues have agreed to support anyone. So if anyone walks into one of those venues and says, I'm in trouble, I need help, I can't get home safely, I'm being followed, whatever it may be, they're all now trained to support that member of public walking into those venues. The football club was the first to sign up. All our libraries on Borough are now a safe haven. Our polka theatre is now a safe haven. And we're just working with the Mitcham Town Centre manager to see if we can get some more Mitcham venues. We're also opening it up to anyone and everyone that is a business as such. But when I send the slides, you'll be able to go on our website and see where those venues are. The one project that does make me smile lots and lots and lots is our Empower Her project. It's run by our young women and girls youth worker, and they met every week and it was about how you empower girls to grow up to kind of healthy, strong women. And as part of that, they did a 4-week course around domestic abuse and violence against women and girls. And at the end of it, they become white ribbon change makers. So our first young people becoming white ribbon accredited. They did a poem. They did 2 poems as part of that project, and we entered those poems into a competition in Peterborough. There was a lady wanting to produce a book around survival from domestic abuse, and she opened it up to the rest of the UK. So we submitted the girls' poems, and I'm pleased to say that they have been published in that book. I haven't got a copy just yet, but I'm waiting on it. So they went up to Peterborough Cathedral. They were all presented with books. They all got to read their poem out, and they were kind of in a room with other women that were either being empowered or has survived domestic abuse. So a massive achievement, and it's that work we want to carry on doing. The other thing that I wanted to share with you, our achievements around our domestic abuse service. We've had a domestic abuse service on Borough probably for about the last 15, 18 years. Our domestic abuse service also supports male victims of domestic abuse. And as of last year, about 22% of our victims of domestic abuse are men. But some of the statistics here, our one-stop shop, which is our drop-in on a Monday, in the whole of 2025, we had 223 people drop in and ask for help. Our IDFA service, that's our domestic abuse kind of front door, 9 to 5. We've got workers that will support victim survivors, and they had 610 referrals in December, and that's probably the highest we've had pre-COVID, post-COVID. So they are super busy. And the MARIC, so our multi-agency risk assessment conference, that's our case panel for high-risk domestic abuse cases. That's what I was in today. Hence why I thought it was this morning, not this evening. And in 2025, we discussed 586 cases. So it's really, really busy. And a lot of that is down to our agencies across the borough, statutory and non-statutory, kind of identifying victims of domestic abuse and referring them in where they're high risk. So our new strategy, we have captured a lot of the work we did in our previous strategy and what was positive, what we needed to change, what we needed to review. We also went out to our partners to see what their concerns were and their positive achievements. And we also put it out to our residents. And we had over 60 responses from members of the public. And members of the public were also saying similar things to what our professionals were saying and what our survivors were saying. So that's why we kind of put it all together, and this is how we got our 5 priorities. Number 1 is changing attitudes and behaviours. And everyone felt that should be priority number 1. I think if we can do that early intervention, that early education, we could potentially prevent victims becoming victims and perpetrators becoming perpetrators. Priority 2, improving the safety of women and girls. That come out really heavily from our residents. Even though we are a very low crime rate borough, the fear of crime is quite high, and from women it was higher. So that's why we wanted to put that kind of as priority 2 and kind of build on some of that work we're doing around our safe havens, around our white ribbon walks and work. And priority 3, that early identification and help. I think from our professionals, that was key for them. You know, if we can identify it early, we can intervene early, we can offer help at an early stage to prevent harm. Priority 4 is that supporting survivors, victims and their children. And I think under the Domestic Abuse Act 2021, children are now deemed victims in their own right. So we are looking at, when we say they're children, those children are also victims. So it's how do we support children that are victims of domestic abuse. And priority 5, holding perpetrators to account. I think everyone we survey said the same. We want to hold perpetrators to account. If perpetrators want to change, how do we help them? And what does that accountability look like? So under these, we've got kind of some of the objectives, and from some of these objectives, we've got lots of actions. We've been very ambitious while working kind of with partners and the residents and survivors. Like I said, priority 1 is about that working proactively in the community, and kind of understanding the root cause of vulg and domestic abuse and how we tackle it. The priority 2 is about how we reassure women and girls, but also how we make people feel safe within our borough. Lots of residents come up with lighting, CCTV, cutting hedges. So we're working really closely with those teams in the councils around how we can improve that, how we can educate residents on how they can report issues around kind of hedges and trees and lighting, so that actually our teams can go out and kind of fix those issues to help with some of that reassurance. And that's where the safe havens come in as well in our venues. The more venues we have, the more public can kind of know about those venues and about walking into them and asking for help. The early identification, again, that's working kind of multi-agency with all our partners across the borough, whether that is kind of council, health, police, third sector, voluntary sector, and looking about how can we offer everyone training to understand domestic abuse, honour-based abuse, forced marriage, coercive control, and actually how do we upskill all our partners to help with that early identification, but also upskilling those professionals to know where to access help. We have lots of organisations that work across Pan London that Merton can use when we've got victims and survivors of vulg, and how do we communicate that to our residents and our partners. The supporting victims, survivors and their children, it is looking at those services and what services do we have access to. Again, we have our domestic abuse service on borough, but actually we can use a lot of those Pan London services for anyone that's experienced sexual violence, honour-based abuse, forced marriage. And we've got some amazing specialist organisations across London that Merton can use to do those referrals. But it's also looking at how do we join up together to support families and to support victim survivors, and some of that aftercare. So we know that for some of our survivors, they've said, okay, crisis is over, but it's taken me a good few years before I can process, and now I'm ready for other support. And what does that look like? So we're trying to pull that together so that our survivors can kind of access that kind of aftercare support. And the holding perpetrators to account. We work really closely with probation, criminal justice and the police. Obviously, our criminal justice system can hold perpetrators to account, but how else can we do that? And for some of our survivors, they said, justice might not be in a courtroom. Justice might be that someone just believes me, or that my perpetrator's been arrested. There may not have been evidence, but someone believed me and that perpetrator got held accountable when they were arrested. So actually we're working really, really closely with some of our survivors to kind of look at that and say, well, what does justice look like for everyone? Because it's very different. And how do we support those survivors if they want to go through that criminal justice system? We have the Drive programme that is across all London boroughs, and it looks at those high harm perpetrators, how we work with them, how we interact, how we disrupt them. So there's lots and lots of actions for our criminal justice colleagues, and including our Drive project. But it is, I think, for us to learn what does that holding perpetrators to account look like for us as a borough, but also working with our survivors. The next steps from our strategy, like I said, our action plan, it is ambitious, and we wanted to be ambitious because we wanted to make sure that we pushed ourselves and that our survivors and residents kind of held us to account. The strategy along with the action plan is on our website, and I'll put the links in the chat. It's going to be monitored through our Violence Against Women and Girls Strategic Board on a quarterly basis. And we've also got kind of an away day morning with them in April to look at what do we want to achieve in year 1, year 2, year 3, who can help us achieve that, and kind of assign some of those actions to some of our partners. The action plan, I think, is going to merge and it's going to change as we go through the 3 years. I think there's some things that we might go, actually, we've achieved that, but what else do we want to set ourselves? And I think some of the actions may, the wording may change slightly as legislation comes in or as teams kind of change and kind of develop. And I think the biggie for all of us is about how we just safeguard and support victims, survivors, the children. And I think it is that understanding that, yes, we want to hold perpetrators to account, but at the end of the day, they are humans in Merton. And how do we also support them? Which I think is a bit of a shift for us, because it's always, we always look at perpetrators as, the horrible ones, and that's correct in some ways, but actually how can we intervene with some of those perpetrators to understand their needs, to help them to then reduce the risk to our victims, but also to stop those perpetrators from going on and perpetrating with others. Let me start sharing and then I can see you all again, because you all vanish when I share. And what I will do is, as we are talking and questions come up, I will pop some of these links in the chat for you, so that you can kind of access it off the chat as we're chatting. So that's a quick overview, like I say, of our VORG strategy and what we are looking to achieve over the next 3 years. If anyone's got any questions, I would listen while putting things in the chat for you.
Zoe, thank you so much for that presentation. And one of the things I want to say is I love that statement that you said about the survivors when they feel that they're being listened to and somebody believes them. I think that's so important, because that is where the big crust of it is, that a lot of the survivors just don't think people believe them. Just before I ask the questions, I know Hannah's going to ask a question, but we've got 2 people who joined us, Dr. Anu and then Sean. So Dr. Anu, could you just introduce yourself, please? Sean, could you please introduce yourself?
I'm quite a regular attender of the Joint Consultative Committee meetings. I've been to, I would say, about 80% of them since 2020.
Oh, no, it's not that. It's just, I appreciate that. It's just that we all went around and introduced ourselves. That's why, just in case nobody knew anybody. That's why.
Okay. No, I was just a Merton resident, and I had a pilot scheme, right enough, funded by Merton Bain Voice, that we ran from February the 4th to March 11th around domestic abuse.
Okay, thank you very much. Right, Hannah, did you want to have your clarification?
Yes, Zoe, I noticed that there's an awful lot about abuse against women, but I'm not sure that it's the abuse against men is getting as much perhaps attention, because that seems to be a growing field that's happening at the moment. And in priority 2, you talked about improving safety of women and girls. And then in the final priority there, you talked about bringing perpetrators to justice. And for most people, when you talk about perpetrators, you're thinking about men. So I just wondered whether the work that you're doing with men could perhaps have been better reflected or more reflected in your plan.
Yeah, no, thank you. So I think, first of all, it's kind of really to highlight, yes, it is a strategy for women and girls, but we've kind of acknowledged that under the Domestic Abuse Act, victim survivors can be men or women. So we've acknowledged that in there. But I think from the government's Freedom from Abuse strategy that come out just before Christmas, there's an explanatory around the government's kind of expectations around men and boys. And I think for us as a borough, we have always said that we would support men experiencing domestic abuse. And I think over this coming year, I think there's going to be more of that focus. And I think Merton as a borough will need to discuss, do we have a strategy for men and boys? We've got men and boys experiencing domestic abuse, but we've got boys that are also experiencing domestic abuse in households. They are also kind of experiencing other kind of forms of crime around kind of county lines, whatever we want to call it, exploitation. And actually, I think because of the government's work and because we are passionate about working with men, I think there will be a need for something around a dedicated policy strategy, something around how we support men and boys. We know that some men will experience honour-based abuse or forced marriage. You know, I've worked with some of those men. And looking at our figures, like I say, that 22% of male victims of domestic abuse, I think the more we advertise our services, the more men are going to feel confident to come forward. So we are super kind of passionate about supporting men. So I think that's where some of the confusion comes in as well around the VORG strategy and kind of men. And sometimes we have to separate it, don't we, around, well, men experience domestic abuse as well. We've gone with the VORG strategy because our prevalence of crime is females experiencing these crimes because of they are female. But I think as the year goes on, we will be definitely looking at what does that look like for our men and boys. And we're slowly doing some of that work. Like I said, within schools, we're understanding what boys' worries and concerns are and looking at how do I grow up as a boy becoming a man. So we're definitely going to be focusing on that. And it's something I'm really highlighting for the April strategic board around, yes, we've got this strategy around women and girls, but actually what's come out of it and what our residents said as well is how do we look at our men and how do we support those men as well as our women. The perpetrator bit, for us, there's no assumption around who that perpetrator is. So in terms of domestic abuse, that perpetrator can be male or female. When you look at violence against women and girls as a whole, when you think about kind of honour-based abuse, forced marriage, FGM, so our harmful practices, we have men and women perpetrators. So I suppose it's done depending on the subject, if that makes sense. So within the domestic abuse drive programme, they look at perpetrators per se. They don't have to be men. Majority of the people they work with are men, but they do work with female perpetrators as well, as long as they are that high harm. And I think there's going to be some more work looking at female perpetrators because we are seeing more and more female perpetrators as we're seeing more male victims. So I think there will be some work around that. But I think that perpetrator piece, I think especially for the police and probation and the criminal justice system, it doesn't matter about the gender. You've perpetrated a crime against someone and how do we hold you accountable? So it is, I think this new strategy has really opened up lots of discussions around that gender piece and how do we as a borough look at that. I'm working with a male organisation at the moment and they do lots of advisory work to the Home Office around what are they seeing in London but out of London. I think out of London have got it right around male work. So it'd be interesting their thoughts and feelings and how they can help advise us. But I think across London, when you look at the male stats, I think it's something like 27.8% of domestic abuse cases for the Met, it's a male victim. So us at 22% is very similar. And I think a lot of that when working with men, and I've worked with men over the years, I think a lot of that is around that stereotype. I'm a man, how do I tell another man? Am I going to be judged? The system's set up for women, am I going to be believed? That service looks like it's for a woman, not me as a man. So I think our understanding around the barriers for male victims, I think, is growing. And I think the overview and scrutiny, the Office of National Statistics, they've just released some new data as well, and they're updating that data around domestic abuse and that gender gap. So it's a really good question. And like I say, I've supported men over my 20-year career. They still feel like any other human. There's shame, there's embarrassment, there's coercive control, there's financial control, but actually how they access services can look very different because they are a man. I want to go in all the places you can think of and say, come on, men, come forward. You know, we want to help. So we are working with specialist organisations like the Male Advice Line and some male organisations to say, what should that communications look like for our men? Because it is a very different comms piece to how we would advertise to female. Even on the basics, like the colours we use, the language in some of our comms, because I think there's always been that assumption that men think that services are for women. So I hope that helps answer some of those.
Yeah, I think it's really important because sometimes the abuse can come about because men feel that, you know, they're not being listened to, just as women used to feel. So it's really important. And also Sean's point about the project which he's just started, and I think if you could work with him and work with his organization, you'd get a lot more information locally from the grassroots rather than concentrating on London wide.
Yeah, no, definitely. And I think I will be linking in with Sean, definitely. That's on my to-do list. But yeah, no, I think we've always educated our professionals that if a victim walks in, regardless of who they are, you believe them at that first point. And we learnt that when we had the murder of Banaz Mahmood in 2006. You know, she wasn't believed by professionals. So I think our stance has always been, you believe someone the minute they present and disclose. And there'll be a lot more about what does that look like, because we know that some professionals may have that unconscious bias around, well, this man can't be a victim because he's a man. And it's how do we tackle some of that?
Thank you.
Right, thank you for that, Zoe. You've got two more people wanting to ask questions. One is from Agatha first, and then I'll go to Desta. Thank you.
Thank you. Thanks for your report, Zoe. But as you know, I've been going on about 5 years about supporting men because, as you pointed out just now, it's got to about 22%, which wasn't really the issue I was talking to you about. I think there should be a strategy, whether it's a small one or maybe there should be something about how we can help support them, because as I've said time and time again, it's getting bigger and it's really difficult to actually say what's happening. I think people now are beginning to do that. Maybe they can report what's happening, but whether they believe is a different issue. And also, you'll see about boys happening. I think if we just try and find another term for the misogynistic. You can't be telling a young boy that they're misogynistic and then you don't understand how they're feeling, because they're confused at the moment, because 1 minute they're misogynistic, next minute they're not. And they just don't know where they are, because not every child, every man is misogynistic. So we have to know where to use those words, because we might think it's a benefit for women or benefit for women, but it's actually becoming a detriment to women as well. Because, you know, some women are misogynistic themselves in a way, if I can use that word. So we have to find ways of using words, especially with the young people, and find ways of supporting me more and more. That's how we just said, about this about 5 years, and I'm glad, you take it. I'm not sure you're not taking it seriously, but I'm taking it seriously because, as I can see, things will get worse and worse over what I see around.
No, thank you, Agatha. I think, that voice box work that's going on is key because it is about that equality. What does it look like for each as a young person growing up? I think under the Domestic Abuse Act, a man can now present as homeless fleeing domestic abuse. And I think that's a message that's been there since 2021, but actually it's how do we get that out further? So actually, if you are a man and you're fleeing domestic abuse, you can walk into any local authority and present as a victim of domestic abuse under new legislation, because the legislation covers any gender over the age of 16. So I think that's another key point. And I know that MOPAC, they're going to release their the Mayor's Office is going to release their new strategy. I'm hoping it's due soon, but they are really focusing on how can we fund male services as well, and what do those services look like, because it is very hit and miss in all the London boroughs. And I think when I go to those London meetings and I say about our statistics, everyone's quite surprised and like, well, how is your rate so high around male victims? And I think it's just because of that advertising, some of that comms we do. So I think it's going to be really interesting as well to see what kind of the Mayor's Office direction is around this. But no, it's something I'm really keen to do, whether it's through focus groups, whether it's we do some consultation, but actually what does it look like for our men and boys? Because you're right, Agatha, some of that kind of dynamic has changed around women's safety, and then men and boys feel like, well, I'm a good man or boy, and why am I being poked as well? And we hear that from our students with VoiceBox. So that's why VoiceBox have been key for us around, well, what does equality look like? Yes, you may be a boy or you may be a girl, but you are still you and you're unique. And how do we kind of harbour that and make sure that there is just that equality? So I think it's something that I'm really keen to kind of get going, get Merton talking about. Like I said, I've had direct experience working with male victims of domestic abuse, forced marriage and honour-based abuse. And yes, they do, that is an additional barrier for them, but just being a man. So it's how can we kind of change that?
Thank you. Despa?
Thank you. I just wanted to commend Zoe on the work that she's doing, obviously, and her teammates in trying to tackle the issue of domestic abuse.
Yeah.
I don't have a question, but rather a suggestion that in getting the word out and engaging with the male population or male residents of Merton, one of the things that we've tried here in Croydon is that we try and go where the men usually congregate. And one of the most popular places, as everyone will know, is the barbershops.
Yes, barbershops and gyms I've been told to go to.
There you go, right? So, and so one of the things you could actually look at is to the extent that you can engage with the barbers themselves as advocates, because men talk to men, contrary to what women might think. And a lot of very interesting conversations happen in those barbershops. And if barbers are, made aware, and they can be a first point of contact to assist, a man to get the intervention he needs, that might be worth looking into.
No, it's a brilliant idea. And I know that there is another London borough that trained up some of their barbers around this. Because I think it's really interesting when I kind of think about it, that we've had a number of ladies come to us, and when we say to them, how did you hear about us, they said their hairdresser. So actually, we, like you say, that barbers I think is going to be key, because you do chat in those settings, And actually, I know that, like I say, that London project, they did train barbers up, not just in domestic abuse, but also that mental health piece and that suicide prevention piece. So I think it's a brilliant suggestion that we can add to that comms piece. I was also told gyms, just because it's a bit of there's a real dynamic in gyms. You know, there's a real kind of, should you look this way and should you look a certain way and how should you, you know, so I think there is that kind of, how do we tackle going into gyms and get men talking. So no, brilliant suggestion, and it'll be those suggestions that I'll want to pick up and kind of have an action plan for how we work with men. Yes, I don't mind going around the barbers. I'll take my travel cup with my cup of tea and go around all the barbers.
It's a great idea, but I would suggest that if you do go, if you have a few leaflets around indicating where they could go, don't overdo it. So they've got some there, or they can put a couple of postings up where they can actually, it may be something you may not want to talk, but they'll just see a leaflet to go, which would be, yeah.
Definitely, but I want to kind of, because the current poster we've got now, we've had for quite a while, and we've tried to keep it neutral, and our language is very much if anyone is experiencing domestic abuse. But I think for us, it would be great to have kind of that male focused poster. So are you a man, like really name it, are you a man experiencing domestic abuse, forced marriage, honour base? You know, do you need help? Do you need support? So I think I'd be really keen as well to kind of, yeah, market test a new poster for our males, because I think we need to really be explicit in that this service is for a man. Because I think that's half the problem at the moment, is a lot of men look at it and just make the assumption it's for a female.
Right, sorry, I've got 3 things, so bear with me. Firstly, it'd be brilliant if you could come back to JCC to engage on the work with men and boys, and, you know, obviously, you know, like we've had brilliant suggestions, that'd be brilliant, that's one. Number 2 is, you know, the safe havens you were saying with the businesses.
Yeah.
So, like you said, there'd be a list. So, say, for example, how do we relay the message to youngsters to say, right, you look out for that sign? What would be the sign if a person?
I'm going to pop it in the chat for you now, but also
is there like a logo or something to recognise it?
Yeah, so there's a Safe Haven logo. So this scheme is designed and it runs across London. It's designed by the Safer Business Network organisation. They work really closely with kind of police and private businesses around making, it originally started for the nighttime economy, to make the nighttime economy safer. But I think the Safe Havens has been so well received that actually they've now changed the criteria. So it's not just about the nighttime economy, it's about any business. It does have a logo with hands, and what we've been doing is we kind of put the comms out around the launch, but we wanted to get more venues signed up before we do a full comms piece from the council. And we wanted to make sure that we put the right information on the website, and then we can kind of advertise, if you see this sign, this is what it means. So yeah, we wanted to get a number of venues signed up first, especially those kind of statutory ones, should we say, like the council, like Vestry Hall, like the libraries, because we know that they're kind of places that residents will go to quite often. So yes, so the plan is at some point this year, there will be a full comms piece on what to look out for if you are a resident.
In reference to, like you said, the safe haven, sorry, I'm going on about that. I don't know if you know, recently, I can't remember, there was a shopping, I think it was Zara or something, and a girl had gone to ask for help and they didn't help and she was beaten up by a gang or something. And so, like you say, you're trying to get more businesses on board. So what is it that's preventing the other businesses from joining? Is it the lack of confidence, lack of training? What is your obstacles at the moment?
The training is run by the Safer Business Network. and it is the training is WAVE, so welfare and vulnerability training. So it trains everyone in that venue what to look out for if someone is vulnerable or there's a welfare issue. The police used to do that training as part of the Ask for Angela offer in our nighttime economy. It's now the Safer Business Network that runs that training and also kind of runs the Ask for Angela scheme across London. I think with some of the police changes, that's where the Safer Business Network picked it up. So they do, so those venues will get that specialist training around what to look out for, what does vulnerability look like. It will look at someone's behaviour, you know, all those sorts of things that we would do with anyone that was vulnerable. So there is training, like I say, that Safer Business Network do, and all our venues go on that to do that training. There's also an ask that if there is an incident, we keep a log of those incidents so that we can understand what's going on, what worked, what didn't work, and how can we work with that venue. So yeah, so there's a couple of bits around that training, but I think what we've found, especially with the nighttime economy businesses, is there's a lot of staff changes. You know, someone could be in the job 10 years, someone could be in the job a week. So we always try and make sure that there are not just one person is the named person in that venue, that actually we have a couple of contacts, so that actually if one does leave, we can contact someone else. But it does, yeah, there are lots of the bigger, should we say the bigger brands like Zara and others, they will have license conditions depending on the venue, but some of those bigger brands, it can be really tricky to implement across that whole brand in every shop in the UK, and that's something that the Safer Business Network are raising with these bigger brands, because they have a lot of links in with the bigger brands around what are they doing. So yes, I remember seeing that Zara incident. It was awful.
Just to say again about Safe Haven, so like obviously this being the JCC, and you know, like you're hopefully going to come back about engaging with men and boys. So a lot of like in the, you'll have a lot of ethnic shops that you know you may want to have the help of JCC members, or we could branch out and approach them on your behalf if that was needed. You know, I'm sure a lot of members would be happy to help.
Yeah, definitely, and I think that's where these key contacts are going to come in. So yeah, I'd love to come back and kind of give an update and let you know where we're at around both the org strategy and that MAL work. Just a couple of, I've seen there's a couple of bits in the chat, so I thought, oh, rather than typing and chatting, which multitasking at this time of night is not great. So I think
we got one more question from Agatha.
Okay, Sean, just to say on the men's sheds, Mark Robinson in our community safety team, he does the neighbourhood watch and the community engagement work. He's working around setting up a new men's shed in Merton. Okay. So I'm wondering, I know you've messaged me, so if I message you back, Sean, it might be worth how we link you in with Mark around that, because I'm working with Mark around what does those men's shed look like for us and some of the comms. And just to say, Hannah, yes, I remember 15 years ago, I think it was Croydon that started out with the barbers around kind of the AIDS, HIV, mental health. I remember that. We've been around too long.
Yeah, sorry, but the safe havens, the shops, whether they're interested in doing other policing for or safer neighbourhood info. But after they've got information that if anything's happening, how do they get in touch immediately, or what's going to happen? Because people might be willing to support. But if they know the incident's going to be, they can't get hold of the police. It's a different matter. I know you mentioned we don't have any shops, but I know that we had a WhatsApp group where if anything was happening in the shop, You can just send a message to the police and so-and-so's here. Okay, is here this one thing, let me know. So somebody could get in touch with them, whether they turn up, but at least it's not. If you're going to ask these groups, such as groups or shops to support, then you make activations, meaning you've got police for the safe neighborhood involved, so they know who to go to, where to get in touch with them, or how to get involved, so they would actually feel a bit more comfortable in joining.
So I think the audio was breaking up a little bit. So was that around the police and?
Yeah, it's around the police. Sorry, I'm listening. It's around the police. I said, you've got all these groups, safer havens. With these shots, but they might not want to join because of lack of police support or anything like that. And in Mitchell Town Centre, we had a shop. We had police at the phone now in WhatsApp group, where if they were part of it, so if somebody said so and so's around, can you go? They'll actually be reading and get involved. I don't know if they can do something, but if the groups are joining, the shops or the businesses are joining, they need to be able to know that they can get in touch with me somehow, somewhere, maybe not immediately, or maybe immediately they need something more people who want kind to join if they know they're going to get support as an incident. So have you thought about that? Basically, that's what I'm saying.
Yeah, so just the police and kind of some of the shops. So obviously around the safe havens work we do, we've kind of informed the police around our safe haven venues, so they know that if there was a call out, they know that that's a kind of haven and someone may have walked in. Around some of our shops and our town centres, you might have heard we've got our new Safe Streets neighbourhood wardens that are out and about as well, and we've got them to engage with some of our businesses, and they've had some really great results around shoplifters in Malden Town Centre. So we are working with them as well to help us liaise with shops and businesses. The business team, Sarah Xavier's team, are also looking at working with businesses and how do we support them more. And again, the safer neighbourhood teams or the local policing teams, whatever we call them, I can never remember. There is some work around working with them more closely because they know their wards and where their problem areas are. And we've also let the local policing teams know about our safe havens. So again, if it comes up on a crime report, they know that Mitcham Library is a safe haven or Vestry Hall is a safe haven. And actually that incident that might have been reported as harassment has actually come out from that place of safety. And it's not just the business ringing up 999 saying someone's harassing. So actually they see it kind of in that context. I hope that answers, Agatha.
That's what I was concerned about the safe haven, but you absolutely roundabout anyway. But when it comes to shoplifting, the police are on the WhatsApp group anyway. And the safe haven team are there, but you know about the safe haven to get more people to join if they know the police are involved. They're more likely to sign up if they're more likely to get involved. They're not going to end up being up with things going on that to get hold of them.
I'm only capturing some of that. I have to say the audio.
Sorry. Can you hear me?
Yeah.
So basically, we've got, obviously you want businesses to sign up for the safer haven.
Yeah.
But the thing is, if businesses are going to sign up and they've got somebody coming, God forbid, a victim, but what surety is that the police are going to come and they can quickly call the police and the police will be there? Because if there isn't, they're obviously taking on this, not this extra responsibility, and if they haven't got the assurity that the police are going to come, it puts the businesses at risk, doesn't it?
So I think ultimately it's not about the responsibilities taking ownership. It's just that stopgap. So actually, if someone comes in and says, "I've been robbed, my phone's gone, can you ring the police for me?" That is where they will say, "I am so-and-so off licence, I am a safe haven in Merton, I've had someone walk in, they've been robbed, they've lost their phone." So they would ring up up and support that victim. So rather than them taking that kind of safeguarding role, they kind of will help offer, you know, other things. So that's how it works as a safe haven. So it's not for that business to become the expert or to do it, but it is, we do train them on when you ring 999, it is to let the police know you're doing it on behalf of someone that's walked in because you are a safe haven. And the police know about the safe havens because the Safer Business Network has been working with the Met as a whole around what safe havens are. So I would hope, and touch wood, you know, we've not had anyone walk into our safe havens as yet. But we know from the training that the venues have been given, they have all felt confident that actually I could do this, or I could use the phone, give the phone to the victim, they can call the police, I can give them a bottle of water, I've got a phone charger, I can charge that phone for them. You know, if there was a major problem, I know to lock the shop down, the business down, ask the security to help. So there's lots of different things that they get in that training, so that they become a bit like a bystander rather than the person responsible.
Right, thank you. Any other questions? Zoe, thank you very much, and that's been really helpful. And obviously, it would be great to have you back at the JCC to give us an update, and if there's anything we can do to help to work together within the community, we'll all be happy to help you with and get all the other members on board.
No,
Right,
definitely. Thank you, everyone.
You could more than happy to stay on and see the rest evening, or we want to escape because you've had a long day. So we won't touch. Right, so the next item is, we're very lucky to have the Croydon BME Forum. We're going to present the Community Health and Wellbeing Support Initiative. Thank you.
Okay, thank you everyone. As indicated before, it's a pleasure being here. The initiative is pretty much based on a model that we have adopted successfully in Croydon and would like to infuse into the community of Merton. Southwest London has indicated that the uptake of vaccines in that area is way below the expected projections. And one of the reasons why we would like to engage with the organizations in Merton is so that we can partner with them to improve the uptake in those communities that, you know, are registering low uptake of vaccination or vaccination hesitancy. Now, the strategy that we have successfully used in Croydon is one in which we lead not with vaccination as the main focus of any engagement or events that we will be having. And we are able to do that because we have residing within the Croydon BME Forum a number of initiatives and projects that are engaging with the community, spanning mental health. For example, Macmillan Can You See Me Cancer Support Program. We partner with the AIDS Healthcare Foundation UK. And so there's a wealth of support and health and well-being resources that we have available to us. And the presentation that we want to focus on for this meeting is how can we partner with organizations? Could you go to the second slide, please? How can we partner with organizations to help us to penetrate into those hard to reach places? The project's core aim is really increasing, as I said, equitable access to health and well-being support for the residents of Merton, right? The model is built on design by partnership framework, where we work with organizations that are already in the space who are doing good work. For example, Zoe's team And I heard her mention that she had an event where that was focused on men, and they came out and walked, and that was a successful event. We would like to partner with organizations like yourselves to bring information into the space so that people can learn and access information and can be signposted, supported, and assisted wherever the needs exist. Three of the ambits of that model is that the program is flexible in that delivery time and place in reaching the residents. So we will go wherever you are and wherever the residents are gathering or can be invited to gather. We're accessible. Accessibility is very important. So for example, you present at a forum or an event, whether in person or online, information about, let's say, MMR vaccination, and the bulk of the attendees there are parents. Then after that presentation, how are they then able to move from getting the information to actioning, the information in a tangible way? So accessibility and support is very important for us. So we would like to establish vaccination drop-in hubs, for example. And among the other services that we do health checks, and we would like to pair that with the vaccination outreach program, and also the Macmillan Cancer Support project, so that people who are in need of support regarding issues around cancer can be supported. The third ambit of the project is that it's culturally sensitive. The information and the way we engage is done in a way that people don't feel like they're simply spoken at, but they're spoken with. And our mantra for that is that I see you, and we see you because you matter. Okay, next slide, please. Our successes in Croydon, I alluded to some of those earlier, but we have been able to successfully penetrate the group that we consider to be hard to reach. And some examples of those are elderlies. We have a huge following of 50s and 65s and above. A lot of time these persons are not given the kind of attention they need. And so because of the social programs we have to get those people out of their homes and places and engage with them, because they've already been invited to be in the space, then it's easy to have a conversation with them about their health and health concerns. The immunosuppressed, asylum seekers, the homeless, and the neurodiverse. A lot of these persons fall, under the radar because they're not typically in the space that these services are being provided. But we have somehow found a very unique way of engaging with them and inviting them into our space. And that's the kind of approach that we would like to bring to Merton in partnering with the organizations that currently are doing great work in Merton. Next slide, please. And it's at this juncture I'm going to invite my colleague, Unica, who is the program head for the Macmillan Can You See Me project.
I think Anika's
Yes, Unica left the meeting.
She's left. Oh.
Yeah.
Yeah, that's the apologies.
Oh, okay.
Okay, I'm happy to go over it. Sorry. Are we there?
Yes,
Yeah.
we can hear you, Doc.
Yeah.
Dr.
Okay. So so as we're saying, the Can You See Me program is a program funded by Macmillan Cancer Trust. It's a 3-year program, and we're now into the 2nd year. And so we've been funded to work in the 6 southwest London boroughs, and of course one of them is the Merton borough. So this year, on April the 21st, we will be actually hosting the Merton Can You See Me Cancer Conference, and that will be held at the Everyday Church in Wimbledon. And that's on April the 21st. So one of the things that we wanted to do is just to make sure that everyone on this line, on this call and in the room receives a special invite, and hopefully share it out to your community. But a little bit about the conference itself, not about the conference, about the program itself is, as I said, it's been funded by the Macmillan team, and it's to look at the health inequalities within cancer care. As we know, there's a stark difference between the late diagnosis and the diagnosis within certain cancers within our communities, and especially the BME communities within these boroughs. At the moment, we are collaborating with quite a few different groups, such as charities, faith groups, healthcare professionals. We're in all of the hospitals within each of these 6 boroughs, and we have one-to-ones with a lot of the doctors and a lot of the consultants as well. So one of the most notable pieces of work that we have done is worked with people who are facing a cancer diagnosis with St George's Hospital, and what we've been able to do is to create videos which are now used within St George's Hospital as training videos. So a lot of the times we were getting a lot of the focus groups and the people that we've spoken to over the last 2 years, they were saying that the nurses, the doctors, the hospitals are not listening to them. So when they come and are presented with their issue, they're not being listened to, or the information relayed to them is maybe not relayed in a cultural sensitive way. So we've created some videos which are now being given to all doctors or nurses for them to kind of understand how people from maybe different cultures feel. As I said, we've currently hosted 3 conferences out of the 6, and the last 3 will be Merton, Sutton will be held in July, and Richmond will be held in October. Next slide, please. So how we work and how we are successful is by, I said, working with our local organisations, NHS partners and community groups to co-design and deliver. So it's very much like what Desta was saying, was the way how we do it is we work with our communities, and then we work with the doctors and the nurses to make sure that we're both ending up in the same position. So some of the stuff that we do is community pop-up events, collaborating with different event organisers, health and wellbeing hubs, vaccination clinics and health checks, health and wellbeing engagement sessions, conferences, delivering cultural tailored health information on a range of topics, events held in trusted community spaces, and online engagement events as well. So we are currently based in a local area in Wandsworth called the Doddington Estate, and we're there every Thursday. Now, what's that's done, that now means that people in that estate knows that every Thursday there will be a Macmillan Cancer support worker there, and they are able to come and speak to someone about any issues that they potentially might have. Next slide, please. So for you guys, we want you guys to play, I said, a important role is by sharing this information out to your communities. It is not just black people, it's not just white people, it is for the people in Merton, and we want this conference and we want everything to kind of go out far and wide as possible. So we will make sure that we send the save the date and the flyer to you guys so that you can really share it with everyone in your communities. And over to you, Desta, I think.
Thank you, Dr. Brown. Much appreciated. So basically, we're pressed for time. What we really want, as Dr. Brown said, is to partner with the organizations on the ground. And coming out of this meeting, we would like for you to reach out to us so that we can meet to discuss how can we help what you're currently doing, yeah, and then how can we work together to uplift and serve the community of Merton in a co-production environment. Next slide, please. Next slide. Okay. Right. So we want to meet with you. We want to talk to you. And the next slide, that's just a flyer, save the date flyer that Dr. Brown will be sending to the organizers of this event so that it can be shared with the other members of the JCC. Next slide, please. Oh, and this is just a gallery of events that we typically will, we hold in our community. We have events at churches, at community halls, we go everywhere, and we touch and meet everyone. Next slide, please. That's a previous Can You See Me conference. Doc, do you remember when that was? I lost Dr. Brown. Next slide, please. And that is again a community engagement event where we had over 60 persons in attendance. That one was held in the Wellness Center in the Whitgift Shopping Center. And that's the kind of energy, the kind of promotion, the kind of engagement that we would like to bring to Merton in partnering with the organizations that are already doing great work there. Our contact information is on the last slide. Again, I will share this in the chat as soon as the presentation is over. And I'm open to any questions you may have at this point. Thank you for listening. Much appreciated.
Thank you, Desta. Really appreciate, and Andrew, really appreciate your input, and it's a big eye opener. And in regards to the invites and save the dates, it'd be brilliant if we could have them sent out to all the members of this committee. And on my behalf, I'm one of the governors for Gesh for St George's and St Heliers. So what I was going to say is, if you could maybe email me, then our full board, I could take it, the governing board, and I could take it forward and get it on the board for you guys.
Thank you so much.
Yeah,
Thank you.
Sounds great. Awesome. Yeah. Okay.
Obviously done a grand job that you've got no questions. So thank you very much. And oh, sorry, Hannah, I do apologise.
Just to say that we've got about 19 organizations, and we'd certainly be more than willing to help you with this and to work with you on this.
Oh, that's brilliant, brilliant. If Hannah, if you can, is it Hannah, is there?
Cheers.
Yeah, if you can put your email address here, I will make sure I will connect you with Unica, who I think had to drop out. Maybe a battery might have died right at the end or so. But yeah, if you could put your email, just I'll make sure that we reach out to you straight away and link in with you. Thank you.
Sure. Okay.
Just to let you know, Octavia will send out all the links to everybody who needs it, so it'll be easy for you just to send and have the email with it. Right, any other questions, anybody? Thank you very much from the Croydon BME Forum team. Right, now on to JCC member updates. Anything? Any other business?
Apart from thanking Hannah for her input.
Oh, I just have to say a big thank you to Hannah, who has done a lovely piece of suggestions for how we can make a difference to the JCC and utilise it and get more members involved. So that work is being taken on by Tober and Dean, and they're looking into it and they're going to apply it to make the changes. So, but thank you, really appreciate that, Hannah, for that piece of work. In regards to this meeting, I'm going to bring it to a close, and I cannot thank you all enough for your input and hope to see you soon.